Coronaviruses are a group of viruses that can cause a range of symptoms including a runny nose, cough, sore throat and fever. Some are mild, such as the common cold, while others are more likely to lead to pneumonia. They're usually spread through direct contact with an infected person. The coronavirus gets its name from the crown, like spikes on its surface, according to the CDC. Corona is Latin for crown. Including the newly identified form of the virus, there are a total of 7 coronaviruses that can infect humans, the CDC says. Other well-known coronaviruses include SARS and MERS. The new virus is called 2019 nCoV. It's unclear how easily it spreads from person to person, but the CDC recommends that anyone who may have been exposed to the illness monitor themselves for 14 days after close contact with an infected person. The new coronavirus incubation period, meaning the time it takes from a person being infected with the virus to when they start showing symptoms, is still unknown. The CDC recommends that patients with the coronavirus wear a face mask to protect others around them, or, if the patient cannot wear a face mask, others should if they are in the same room together. How can I prevent coronavirus? One of the simplest prevention measures a person can take is proper hand washing. Is it SARS? No. SARS, or severe acute respiratory syndrome, is a type of coronavirus that was first reported in Asia in February 2003. Is there a coronavirus vaccine? There is no specific treatment for the new virus, and no vaccine to prevent it. The National Institutes of Health confirmed Tuesday it's in the very preliminary stages of research to develop a vaccine, but declined to provide details. In addition, the drug company Regeneron is in the early stages of work on a potential treatment for this coronavirus. The company previously developed a similar treatment for Ebola. Do disinfectants kill the coronavirus? Yes, they can. The CDC suggests that anyone exposed to an infected patient clean all high-touch surfaces, such as counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets and bedside tables. Cleaning agents can include a household disinfectant with a label that says EPA approved, according to the CDC. A homemade version can be made, using 1 tablespoon of bleach to 1 quart of water. What's the risk this will spread in the U.S.? CDC officials maintain that the likelihood this coronavirus will spread from person to person in the U.S. is low. However, isolated cases from travelers are likely. The first case in the U.S. was reported by CDC officials on Jan. 21. A male in his 30s who traveled from Wuhan. A second case, a woman in her 60s in Illinois, was reported on Jan. 24. Passengers traveling from China are being screened at major airports, including New York's JFK Airport, San Francisco, Los Angeles, Hartsfield, Jackson Atlanta International Airport and Chicago's O'Hare International Airport.